All right, our EBC correspondent in Thailand, Cristel Mapa, joins us live, and she was able to talk to Mr. Natapanu Nopakun, Deputy Director General of the Department of Information and Deputy Spokesman of the Foreign Affairs Ministry of Thailand. We had to tape his interview due to conflict of his schedule and the press briefing that he gives daily to the country. Cristel, how are you?
Yes, Alma, I'm doing good, and I hope you are too.
Oh, yes, I am doing great.
Mr. Natapanu Nopakun had granted the request to give us an overview of what Thailand is doing right now to stop the spread of coronavirus situation here. Let's watch this.
As for the mass testings, the Ministry of Public Health has been focusing on, in terms of targeted type of testing instead of mass testing, because it has been proven that mass testing actually does not actually work for all countries. What they use is they use the term active case finding. So meaning that when there are particular areas or provinces or activities that we know may have a high risk, we go straight to that cluster. We go straight to that cluster and perform active case finding. So most likely we'll find cases because we know about the risk, about the movement and everything. As compared to mass testing, meaning you test everybody in the whole population, the Public Health Ministry of Thailand has tried that already, and the percentage of finding confirmed cases is very, very, very low. So it does not actually correspond. So that's the method that we're going through. Yes. From the looks of it, many countries in ASEAN or even in China, I think, are at the risk of the second wave. So we have been reminding the people to be very mindful and cautious of the resurgence. So if you see the numbers going down, we would not want people to put their guard down. But the thing is, that when people see the numbers going down, they are kind of happy, so they go outside, and there's more traffic now in Bangkok compared to like 2 weeks ago. So which is quite it's quite of concern. But from the looks of it, it seems like the second wave might not hit Thailand as much as in other countries, because our numbers have been steady, been going down quite steady, and we're reminding people to continue to keep their guard up. And of course, because Thailand is not a big country in terms of area size like China, for example. There's a second wave in China in terms of the city of Harbin in the north, when they thought that they had already treated all cases, but there came a re-emergence in that faraway city. But Thailand, we're in sort of a controlled and centralized system of management with all the provinces under the Ministry of Interior. So therefore, it's kind of controllable in some sense. So the measures will have to continue in all provinces around the country in the same standard and level, so as to avoid the second wave. For the case of Singapore, I think it's also specific because it's a small country with a dense population. So they have been doing very well from the beginning, but of course the second wave can hit anybody without them knowing it. So I think with our system of active case finding, of the state quarantine system, of controlling all the inbound flights, and people coming down from flights will have to mandatory, compulsory, 100% go into the state quarantine process. And then all the other measures like curfew, we've received good cooperation from the Thai population as well as the foreign community in Thailand, which are very important. So I think we're on the way towards fighting off or preventing the second wave. Tens of millions of tourists yearly, like 40 million or something. But we are still deliberating on whether to extend the flight ban, because it's sort of like we're in the last, what do you call it, last curve. You know, it's the do or die part. If we put our guard down and allow everybody to come in on the 1st of May, for example, and then suddenly on the second week of May, we become something like Singapore, that would be very, very, very dangerous. All our efforts would go down the drain. So they are deliberating. I think today is Saturday. So Monday, the Prime Minister will have a high-level meeting to finalize this issue about continuation of the emergency decree, the curfew, and the flight ban. But as soon as the flight ban is lifted in, I don't know when, so May, June, whatever, whenever it is lifted, I hope that this will be the norm, meaning that this morning, I actually saw a video of the exact procedures that when you arrive in Suvarnabhumi Airport in Thailand, what exactly will happen, the visual part of it. It's very standard, it's very stringent. I hope that will be the norm when we have normal flights for foreigners, as you asked. I hope that they will put into the requirements something about health. Of course, flying is easy and convenient these days, but in this day and age, health guarantee is important. So perhaps I would be guessing something like more documents when you book your flights, or when you contact your travel agency coming to countries that have been at risk to COVID, like Thailand. Not only Thai citizens, of course. Like we have in terms of labor, over 3 million foreign labor in Thailand from neighboring countries. In terms of expats, in terms of people working in Thailand, I mean, that's very important. We've received many questions about how the government will be assisting for the foreign community as well. Not only in terms of salary or benefits or their loss, but in terms of re-entering the country and living normal lives as well. So I think the Labor Ministry should be looking into this in detail for the labor group, for the expat group. And I know that there are tens of thousands of Filipinos in Thailand, of course, utilizing your skills in language and in the service industry and all the skill sets that Filipinos have in restaurants, in hotels, in hospitals, nurses. I think that's a very good contribution to Thai economy and Thai society. So I don't think that they will be overlooking this in due course. But of course, it's in the realm of the Labor Ministry. But I'm looking into updating this information as well. As soon as I have, perhaps I'll provide that to the foreign community, and perhaps even announce it during the press briefing for the benefit of the foreign community, because the audience in the press briefing are the foreign community and the English language audience. But of course, with my personal experience living in the Philippines, I'm kind of attached to the Philippines. It's sort of like my second home when I was young. When I was studying there as a son of a diplomat, a Thai diplomat. So my message is, well, perhaps we have to think that tomorrow will be better, and that we're one and the same. It doesn't make a difference now if you're Filipino or Thai when you fight COVID. It doesn't make a difference if you're Chinese or Japanese or American or Latin American. It's a common enemy. So as I mentioned at the end of this the press briefing today, I try to be inspirational to the viewers, because I know that this is viewed outside of Thailand as well, and we have a big foreign community. So what I mentioned is, of course, I might have some copyright problems because I mentioned about we are the world. Okay, I mentioned we are the world is us. In Thai, it's เราคือโลก โลกคือเรา So it doesn't make a difference. Now we are in solidarity. We're one and the same. So hope that the Filipino community in Thailand will continue to be a strong force in the economy of Thailand, because it doesn't make a difference now. It's all the same. When the Thailand prospers, the Philippines prospers. Overseas workers, balik bayan, right? When you go back. So when Thailand prospers, the Philippines prospers. When Thailand and the Philippines prospers, ASEAN prospers, the region prospers. And when Thailand is healthy, the Philippines is healthy. It's all one and the same. We're one world, one health. So that's my message. And thank you very much for your contribution and your kindness and your friendship with Thailand.
Christelle?
Yes, Alma, right now, based on Ministry of Public Health of Thailand, the number of confirmed cases is at 2,932. There are reported deaths of 52, and there are 2,609 recoveries. Alma?
All right. So, Christelle, thank you very much for that, for tapping Mr. Natapanu for Eagle Broadcasting Corporation. And I would like to know, how is Thailand doing right now? Is there a flattening of the curve? How are you guys doing?
Yes, so far from the reports that we received today, Alma, there are only 9 confirmed cases added. So it seems like that the curve is already flattening. But as what we have heard from Mr. Natapanu, the Prime Minister will release if the emergency decree will be extended for another month. So we will keep you updated for that.
Okay. You know what? I'm interested also because we know that around ASEAN countries, especially Thailand, the street food industry is very big there. How is that looking right now? I know it's been affected, but with the flattening of the curve, are you slowly opening up the street food industry as well?
Yes, Alma. So far, I wasn't able to see any street food vendor outside because they are not actually allowed to sell foods.
Okay.
But there are some restaurants that are open, but just for takeaway or for takeout.
All right. Okay, thank you so much, Christelle. Maybe we can one day come and visit, or you can one day come and visit here. Thank you so much, Christelle. Stay safe and stay healthy.
Likewise, Alma. This is Crystal Mapa reporting live from Bangkok, Thailand. We live in interesting times.